What is crystal arthropathy, and how does it relate to gout? Imagine tiny crystals forming inside your joints, causing sudden pain and swelling. That's what crystal arthropathy is all about. It's a group of joint conditions where microscopic crystals build up in the joints, leading to inflammation and discomfort. These crystals can be made of different substances, with the most common types involving monosodium urate crystals and calcium-containing crystals like calcium pyrophosphate dihydrate. When these crystals deposit in the joint tissues, they trigger the body's immune response, causing swelling, redness, and often intense pain. Gout is a specific form of crystal arthropathy caused by the buildup of monosodium urate crystals. This happens when there's too much uric acid in the blood, a condition called hyperuricemia. When uric acid levels become too high, crystals form and settle in the joints. Gout often affects the big toe but can involve other joints like the ankles, knees, or wrists. Gout attacks tend to come on suddenly and can be extremely painful, sometimes waking people up in the middle of the night. If not managed properly, these attacks can become more frequent and lead to long-term joint damage. On the other hand, calcium pyrophosphate deposition disease, sometimes called Pseudogout, involves calcium pyrophosphate dihydrate crystals. These crystals deposit in joint cartilage and surrounding tissues. And like gout, which usually affects smaller joints, Pseudogout often targets larger joints such as the knees, hips, or shoulders. It also tends to occur more in older adults. The inflammation caused by calcium pyrophosphate crystals can mimic gout symptoms, with swelling, redness, and pain, but the underlying crystals are different. Both gout and Pseudogout are types of crystal arthropathy because they involve crystal deposits causing joint inflammation. The main difference lies in the type of crystals involved, the joints affected, and some aspects of their clinical presentation. Recognizing these differences is important because treatment strategies can vary. Managing gout involves controlling uric acid levels through lifestyle changes and medications to prevent crystal formation. For Pseudogout, treatment focuses on reducing inflammation during flare-ups and addressing underlying joint issues. Understanding crystal arthropathy helps in managing gout effectively and preventing long-term joint damage. Proper diagnosis is key, often involving joint fluid analysis under a microscope to identify the crystals. Long-term management includes lifestyle modifications like maintaining a healthy weight, staying hydrated, and avoiding foods high in purines for gout. Medications such as uric acid lowering drugs can help prevent future attacks. For Pseudogout, controlling inflammation with anti-inflammatory drugs and managing joint health are essential. In summary, crystal arthropathy refers to joint diseases caused by crystal deposits, with gout being the most common from involving urate crystals. Gout results from uric acid crystal buildup, while other types like Pseudogout involve different crystals but produce similar joint inflammation. Proper diagnosis and tailored treatment are crucial to prevent chronic joint damage and help maintain a good quality of life. Always consult healthcare professionals for personalized advice and management options tailored to your specific condition.